Ladies and gentlemen, welcome to today's WCRI webinar, Designing a Workers' Compensation Medical Fee Schedule. My name is Andrew Keneally. I'm WCRI's Communications Director. We couldn't be happier to have you with us today. For those who might be new to WCRI, let me tell you a little bit about us. We're an independent, not-for-profit research organization providing high-quality, objective information about public policy issues involving workers' compensation systems. We serve as a resource for public officials and stakeholders, but we do not make recommendations, nor do we take positions. Studies are peer-reviewed with a focus on benefit delivery, and we enjoy diverse membership support, including government agencies, employers, insurers, labor unions, and many others. And it is at this time that we would like to thank our members who are on today's webinar for your support. Without your support, we wouldn't be able to provide this research and these webinars. So thank you very much. And for those who aren't members, we hope you will consider it. And there's more information on our website about the benefits of WCRI membership. About today's webinar, presentation is 30 minutes long. That's 20 minutes of slides and 10 minutes for your questions. To submit a question, use the questions box located on the right-hand side of your screen. Just simply type it in and click send. Feel free to send your questions in during the webinar as we're going along. So if something comes up and you have a question about it, type it in. We'll make a decision on whether to address it then, or mostly we're going to try to save them for the end of the webinar so we don't interrupt Olesya too many times. If you're having issues with your connection or audio, please call GoToWebinar at the number below. So a copy of the slides can be downloaded under handouts on the right-hand side of your screen. And today's presentation is being recorded and will be provided within 24 hours. So if you miss anything, don't worry. We'll send you a recording as well as send you a copy of the slides. And at the end of the webinar, we do ask that you take a short online survey. For every completed survey that we receive, WCRI will donate $2 to Kids Chance, which I'm sure many of you know is a great organization that provides educational opportunities to children whose parents were either seriously injured or killed in the job. It's a great organization. So we're going to be talking about medical fee schedule today, but WCRI covers a lot of different topics, and here's some of them. We also invite you to check out our website, which has on its navigation bar topics button, so you can search all the various topics that we cover. And here is your presenter for today, Dr. Olesya Fomenko. And without further ado, I'm going to pass it over to Olesya. Olesya?
Thank you, Andrew, for your introduction, and good afternoon to everybody. And I'm happy that you joined us. Today, in this webinar, I will share with you principal findings of a WCRI study, Designing a Workers' Compensation Medical Fee Schedule. In this work, we highlight major design choices of professional fee schedules that policymakers are facing in designing and updating fee schedules. This study shows how states have resolved these fee schedule design choices. It also offers a comparison of fee schedules across states and different types of services. It also provides a summary of recent changes in professional fee schedules. So what are the central fee schedule design choices? First, the fee schedule basis. And there are several commonly used options: Medicare relative value units, other types of RVUs, also usual and customary charges. Another important question that frequently becomes a subject of public policy debates is how high or low to set the fee schedule levels. And setting a fee schedule level involves a delicate balance. If rates are set too high, savings will be negligible, and the cost containment goal will not be achieved. On the other hand, setting rates too low might result in access to care issues. And next question is also related to fee schedule levels, and that's the conversion factor. And in particular, whether to set a single conversion factor for all services or different ones for different types of services. Then, should a state set a single fee schedule for the entire state or different ones for different regions? Also, it's an important consideration is how frequently fee schedule should be updated and how. And again, also it's important to be aware of the medical services that are not subject to fee schedules or do not have assigned established fee schedule rates. In the focus of this presentation are states with medical fee schedules for professional services. And currently 44 states and the District of Columbia have professional workers' compensation fee schedules. And when it comes to the fee schedule basis, vast majority of the fee schedule states use RVU approach. Over 70% of the fee schedule states rely on Medicare RVUs. 5 states use alternative types of RVUs, and also 8 remaining states, they use some version of usual and customary charges. Since over 70% of the fee schedule states rely on Medicare RVUs, it's important to understand features of Medicare design to have a better understanding of workers' compensation professional fee schedules. And the Medicare RVS design has 2 main components, relative value units and geographic adjusters. In general, RVUs provide a measure of the resources required excuse me, to deliver each medical service. And in Medicare design, relative value units reflect resource requirements along 3 dimensions. First, providers' time and expertise, then office practice costs, such as rental cost and staff wages, and malpractice insurance premiums. As a result, more complex procedures will have a larger relative value and therefore a higher fee schedule rate. Second component is geographic adjusters. And they explicitly measure geographic differences in providers' expenses. And it's done along the same 3 dimensions, providers' wages, rental cost, and malpractice insurance. And these geographic differences in cost of providing care are the only source of variation across states in Medicare rates. Another key feature of Medicare system is that it's regularly reviewed, revised, and updated by CMS. On the other hand, it's important to note that Medicare does not establish values for or rates for a number of procedures provided to workers with injuries. And that results in so-called fee schedule gaps. And some of these procedures are unique to workers' compensation, including work hardening and conditioning services. Also, Medicare does not establish rates for unlisted codes. And another reason for fee schedule gaps is that CMS does not establish rates for services perceived as not medically necessary. An example would be hot and cold packs. So this slide shows variation in Medicare rates across states. And by design, this variation captures differences in cost of providing care across states. Again, differences in providers' wages, rental cost, and malpractice insurance. And in this chart, Medicare fee indices are normalized so that the index in the median state is set to 100. As you can see, Medicare rates ranged between 8% below the median state in Arkansas and 30% above the median state in Alaska. And now is a good time for our poll.
Okay, Olesya, the poll is up. Our question today is, what is the variation across states for workers' compensation fee schedule rates? So Olesya, you can help me on this one, but again, we're looking for the variation between the highest and lowest state. And is it 40%? Yes. Is it about 100%, over 200%, or over 400%? So if you will take the time, we'll give you about 10 more seconds to complete that, and then we'll share the results with you. Olesya, anything you want to add about the poll?
Oh yeah, it's especially interesting question since we just saw variation in Medicare rates across states, and now it's timely to think about variation in workers' compensation rates across states.
Great. All right. Gonna give a couple more seconds and then we will close our poll. Looks like we have about 66% have voted. Give 5 more seconds. And we are gonna close our poll and share the results with you. So, it looks like 49% said 40%, 23% said about 100%, 24% said over 200, and only 4% said over 400. So there you go, Olesya.
Yeah, and it's great to hear from you. And for workers' compensation, we actually observed slightly more than 200% difference between the state with lowest and the highest fee schedule rates. And it's illustrated here on a chart. And here we add workers' compensation fee schedule rates along Medicare rates. And again, we index them to the median state. So the most striking difference between Medicare and workers' compensation rates, as you can see in this chart, is that workers' compensation rates display much more variation across states, ranging between 35% below the median state in Massachusetts to 106% above the median state in Alaska. And this chart also shows that higher workers' compensation rates are not in the states where the cost of providing care is relatively higher. And you can see we highlighted 4 states: Massachusetts, California, New York, and DC. And those are states with some of the highest provider expenses, and it is reflected in relatively higher Medicare fees. But as you can see, these states have some of the lowest workers' compensation fee schedules. So overall, the interstate differences in workers' compensation fee schedule levels are not closely related to the expenses incurred by healthcare providers. So even though vast majority of the fee schedule states use Medicare-based fee schedules, we observe differences in how states implement Medicare design. And some jurisdictions, they just set their fee schedule rates at a percentage of Medicare, meaning that they follow they adopt or implement all components of Medicare, just setting their own multiplier. However, majority of the fee schedule states that rely on Medicare use Medicare RVUs only and establish their own conversion factor. And you can see examples here. So next question that I want to address is how high or low to set the fee schedule levels. And this is one of the most debated questions in the fee schedule policy debates. And this chart illustrates that states have resolved this question very differently. And here we are showing fee schedule differences, workers' compensation differences above or below Medicare rates. And it varied substantially from 5% below Medicare in Massachusetts to over 150% above Medicare in Alaska and Nevada. Additionally, Massachusetts, DC, and Florida, they established their workers' compensation fee schedule rates on average across all professional service groups to be within 20% of Medicare rates. And on the other hand, 6 states on the right-hand side of this chart set their fee schedule rates at levels more than double Medicare at the state. So here we add information on the commonly used types of workers' compensation fee schedules, such as Medicare-based, that's green bars, alternative types of RVUs, yellow bars, or fee schedules that are based on historic current customary charges, green bars. And as you can see, there is no clear relationship between fee schedule basis and fee schedule levels. For example, Medicare-based fee schedules, you can find states with Medicare-based fee schedules along the entire distribution. Some of them have relatively lower levels, relatively high, and typical. So the basis and levels determined separately. Next important question is whether to use single or multiple conversion factors. So what are conversion factors? It's a link between RVUs, or fee schedule basis, and fee schedule levels. It is used to monetize RVUs to obtain fee schedule amounts. And whenever multiple conversion factor approach is chosen, different multipliers are assigned to different types of services. So in this chart, we compare workers' compensation fee schedules for surgeries, that's yellow bars, and office visits, blue bars, for each state. And to illustrate differences between single and multiple conversion factor states, we grouped single conversion factor states on the left side of the chart. And as you can see, most states with single conversion factor set the workers' compensation fee schedule rates at similar percentage above Medicare for both types of services. And when we look at states with multiple conversion factors, typically surgery was reimbursed at a higher conversion factor than office visits. And in 5 states, this difference was more than 200 percentage points. Let's switch our attention to fee schedule updates. And when it comes to fee schedule updates, there are several major decisions to consider. What edition of the CPT publication to adopt, which version of relative value units to use, and how to adjust fee schedule levels for inflationary growth. And again, we do see states address this choice differently. Florida, for example, relies on the 2016 edition of CPT publication, as well as RVUs, Medicare RBRVS, and Tennessee uses the most current editions. So what are the benefits of and costs, of course, of timely updates? First, implementation of the more up-to-date fee schedules helps to stay current with new developments in the medical field and changes in the coding rules. It also reduces the number of fee disputes over reimbursement of new procedures. In addition, it's easier for healthcare providers to use a single version of publication rather than many for different payers. Also, timely updates are essential for workers' compensation reimbursement rates to remain competitive, especially in the presence of medical inflation in the general healthcare system. And when it comes to costs, the cost of regular updates will depend on the choice of the basis for professional fee schedules. And for example, updates of charge-based fee schedules can be expensive, since that would require substantial effort to capture changes in the prevailing charges. For Medicare-based fee schedules, it's less expensive to stay current, since updates to the levels and rules are done regularly by the federal government. And for alternative relative value approaches, that would depend on the cost of acquiring an updated version of that proprietary product. And next, a very relevant question taken into account the recent inflationary growth is how are professional medical fee schedules updated to reflect inflationary growth. And again, states are very different in how they update their fee schedules for inflationary growth. And some states update that using Medicare conversion factor. And it incorporates Medicare economic index, that is a measure of inflation. But it's also shaped by other factors, such as budget neutrality requirements that Medicare has. Other states rely on a more direct use of inflation measures. And an example would be Medicare Economic Index. And again, it's a Medicare developed measure of medical inflation for professional services. Other options are CPI for all items, and that's used by Illinois and Delaware. And also statewide average weekly wages. It's that approach or changes in them actually, and that's used by Pennsylvania. Also available measure, it's changing the CPI-U for medical care. Virginia uses that approach. And in a number of states, states update their state-specific conversion factor. In some cases, they rely on Fair Health, sometimes Optum for that update, or they use other approaches. In the report, we also provide a summary of medical services without established fee schedule rates for each state. And you can find a detailed description of that in the report. But to give you a high level idea is that in the most states, in most jurisdictions, over 98% of payments for professional services are paid for services with assigned fee schedule, with fee schedule rates assigned to them. However, for 6 jurisdictions, we observe a larger percentage of payments paid for procedures without assigned fee schedule. It ranges between 5 to 25%. And then when we look at the service group level or service type level, we find that 22 jurisdictions have at least 10% of payments paid for services without assigned fee schedule rates for at least one service group. And in this work, we also examine substantial changes in workers' compensation and professional fee schedules. And here I'm showing changes since the last edition, that was February 2019 fee schedules. And we found that 4 states had double-digit increases in their fee schedules, accumulating over 3-year period. And none of the fee schedule states changed their fee schedule basis since 2019. And the main takeaways is that we observe a wide variation in the workers' compensation fee schedule rates. I guess it was surprising for many of you, and it ranged from 5% below Medicare in Massachusetts to 150% above in Alaska and Nevada. Furthermore, high workers' compensation fee schedule rates were not related to higher provider expenses. And typically, specialty care such as surgery was reimbursed at a higher percentage over Medicare than office visits and physical medicine services. And overall, the question remains, are these higher workers' compensation payments necessary to ensure that medical providers are willing to deliver timely and quality care to workers with injuries? And at that, I will end my presentation and hand it over to Andrew.
Great, thanks, Olesya. So we're at the end of our presentation. So any questions about the findings that you might not be able to ask during the next 10 minutes during the Q&A, you can always email us. When you exit this webinar, just a reminder to please take the survey that pops up, every completed survey. WCRI donates $2 to Kids Chance. The study discussed today is available for download on our website. It's free for our members and available to non-members for a nominal fee. And lastly, thank you to our members who are on today's call. If you're not a member, we hope you will consider doing so. And again, you can look up the benefits on our website. And also a pitch to follow us on social media, a great way to keep you updated on all our latest research and upcoming events. So with that said, we'll invite folks to send in your questions for Olesya. And I see we have a couple so far, so I'm going to start off with those. One's from Mary. She says, what was the growth in the fee schedule rates in 2022 in response to inflation?
That's a very timely question. Thank you. And as you probably all seen that we did experience sizable inflation in 2022, and in general economy, I think it reached about 8%. And when you look, if you looked at the inflation rates in the medical and general healthcare sector, it wasn't as high. It was up 3 or 4% depending on what measure you use. And for workers' compensation, that will depend on the way states update for inflation growth their fee schedules. And I showed you a slide where Some states do use Medicare conversion factor, and that actually experienced this small decrease in 2022. And then if state use CPI-U, then the increase in the fee schedules would be more sizable of 8% for 2022. And then if a state used CPI-U for medical services, then the increase would be about 4%. And again, it's important to keep in mind that not every state updates fee schedules every year. Some states do that annually, like Maryland, Tennessee, Texas, but a number of states do it every other year, and some states do not update their fee schedule for years. So that would also depend not just on the approach, but this timeliness or schedule of those updates.
Our next
Also, we will
question.
talk more about this question in our upcoming study on medical inflation.
Great. Next question comes from Dirk. Do any states particularly incentivize occupational medicine and vocational rehab services?
We do see variation in the fee schedule rates across states for each type of service, and if through fee schedules, I guess in our study, you can actually see how fee schedule rates are different across states, and in the states where they're relatively higher, in a way, I guess one may say that they're incentivizing the use.
Great. Our next question comes from Mary Beth. If a state wanted to do a comprehensive overhaul of its fee schedule, what would you recommend as a first step to undertake? Now, we don't make recommendations, but I know one of them would be to download the study and review it.
And
Anything else?
and go through different decisions to be made. And we, in this study, we break down all main decisions to be thought about, and also we show examples of how states have resolved it. And you can see comparisons across states of the fee schedule rates to see where they landed with these different decisions.
Great.
But yeah,
Well said.
Andrew said we do not make recommendations.
But we give you all the tools to see how others have done it, all the options, all the important questions. Next question comes from John. Any explanation as to why higher workers' comp fees did not necessarily correlate to higher expenses?
Because the way states set their multipliers and set up their fee schedules, even if it's a Medicare-based fee schedule, it's partly it's a political process, the way the multiplier is set up. And as I showed you, states resolve that question very differently, and we end up having this substantial variation across states in the fee schedule rates. And what I can say, it's not driven by differences in expenses of providing care.
Great. Our next question comes from Chris. What percentage of RVS services are paid through contract/network contract, not tied to fee schedules?
It's a good question, and it's outside of the scope of this study. And in this study, we do show what percentage of payments are paid for services without established fee schedule rates. And I do believe that medical CompScope addresses questions of network percentage of payments paid through networks in each CompScope state, but it is outside of the scope of this study.
And Chris, if you need help finding that in our CompScope studies, please feel free to send us an email and we'll try to point you in the right direction. Our next question comes from Gerald. Did you encounter any data indicating higher fees resulted in greater access to care or greater patient satisfaction?
It's not what we do in this particular work, but there was a series of studies on the on workers' outcome studies, and if I remember it correctly, it didn't find an indication that higher fee scale rates were necessary for that timely care to be provided. And we did see relatively high satisfaction rate in states with relatively low fee schedule like Massachusetts, as well as Wisconsin, that they're on, it's a non-fee schedule state. So there's no clear evidence of that, but it might be of an indication if a fee schedule state has relatively low fee schedules, then policymakers may want to pay attention to access to care issues.
We have one last question, if we can answer it quickly, because we want to stay on time, but this one's from Alan. Does the study have information on how states handled the GAP services? Are they still part of the fee schedule, or were they paid through another method?
Yes, so the GAP services, you can find information on that in table 1 of the report. There are several states that use, even though they're Medicare based, they use proprietary products that define rates for those GAP fee schedule GAP services. And also we show detailed information on what services are not covered by fee schedules and what percentage of payments are paid to those services for each service group. So you may find more information in our study on that question.
Great. Well, that is all the time we have today. Thank you to Olesya for a great presentation and to you for taking time out of your day to join us. We hope to see you on a future webinar. Have a great day.
Thank you for your attention.